Hello everyone, today we're going to talk about complications linked to badly controlled diabetes. So, what is diabetes? Diabetes is a group of metabolic diseases in which the person has a high blood sugar, either because insulin production is inadequate or because the body cells do not respond properly to insulin, or both. For our cases, we're going to emphasize on the complications that arise because of poorly controlled diabetes. For instance, diabetes type 1 lasts a lifetime. There is no known cure. Type 2, it usually lasts a lifetime. However, some people have managed to get rid of their symptoms without medication through a combination of exercise, diet, and body weight control. For our case, being a diabetic patient, it is necessary to adhere to medications. Otherwise, there are very bad complications linked to non-compliance of medications. The first complication is eyes. Eyes will have glaucoma, cataracts, diabetic retinopathy, and more. The second is the foot. The foot will have neuropathy, ulcers, gangrene, which may require the foot to be amputated. Next is a skin complication where people may be susceptible to skin infections and skin disorders. Next, you get heart problems whereby you can get ischemic heart disease when the blood supply to the heart muscle is diminished. People with diabetes will often find themselves with hypertension, which can raise the risk of having kidney disease, heart attack, and even stroke. Next is their mental health. You see, if you have uncontrolled diabetes, there will always be a rise of the risk of suffering from depression, anxiety, and some other mental disorders. Uncontrolled diabetes will lead to hearing loss. Another one is having gum disease. Next is gastroparesis, where the muscles of the stomach stop working properly. Another severe complication is ketoacidosis, where there's a combination of ketosis and acidosis, meaning there's accumulation of ketone bodies and acidity in the blood. Another complication is neuropathy, where nerve damage, which can lead to several different problems. Next is an emergency diabetic complication called hyperosmolar hyperglycemic non-ketotic syndrome. This is where blood glucose levels shoot up too high and there are no ketones present in the blood or urine. It is an emergency condition. Next is nephropathy. Uncontrolled blood pressure can lead to kidney disease. You can develop peripheral arterial disease where there is a pain in the leg, tingling, and sometimes problems walking properly. Next is a complication of having stroke, because if blood pressure, cholesterol levels, and blood glucose levels are not controlled, the risk of stroke increases significantly. The next complication is for the men, and it includes erectile dysfunction, where a man develops impotence. Uncontrolled diabetes can lead to infections, whereby you'll be susceptible to different types of infections. The last complication is the healing of wounds. If you have uncontrolled diabetes, you're susceptible to wounds, cuts, or lesions taking much longer to heal. That is it for today. Please subscribe for more medical content, and it's good to know how to handle issues. And if you have a question, you can just comment below and I will guide you. I am your host, Dr. Nailel. Subscribe for more medical content. Ciao.